Namaste. So this is part 2 of the FAQs in which I'll be addressing the medical questions. So anybody may develop a cough or a fever during this time. So when do you have to get tested for COVID? So you need to get tested if you have symptoms and you have been in contact with a corona positive patient, if you are a healthcare worker with symptoms, if you have been hospitalized with severe pneumonia or respiratory illness, they will test you for COVID. If you have been in contact with a corona positive patient but you do not have symptoms, you need to wait for at least 5 days before giving the test. Okay, so ideally between 5 to 14 days after contact with that patient is when you need to be tested. Another question was how do we differentiate a common cold from corona? So again, it's quite difficult because you have similar symptoms of cough, fever. You may have a little more of difficulty breathing with corona. One unusual feature is you can have a loss of smell or taste that is seen with corona. So if you have to be tested, what will happen? So you need to go to one of the designated labs or hospital. I'll leave a link in the description box below. So they will take 2 swabs, one from the throat and one from the nose, send it for testing for corona, before which you'll need to fill in a form with your demographics and your symptoms and how many days you've had it. So it's a pretty straightforward process. They will give you the report within 2 days. If there is a patient with corona, then and if they've been discharged from the hospital and they come home, how do you take care of them? So although they would have finished the quarantine and the isolation period in the hospital, they can still shed the virus for another 14 days, so you have to be careful. So ideally keep them in a separate room with a bathroom, disinfect all surfaces regularly. The patient has to wear a mask at all times. A simple surgical mask will do. So every 6 to 8 hours they have to change that mask. Whoever enters the room to take care of the patient will have to wear a mask as well, preferably N95. So make sure that the patient has a separate set of utensils, bedding, etc., which you wash separately, and disinfect all surfaces with bleach. When will the patient be discharged from the hospital? So the criteria for discharging the patient will be they should have at least 3 days without symptoms, especially without fever, and there should be at least 7 days from the start of the symptoms, with 2 consecutive negative PCR tests, in which case they will be discharged. So another thing was about the routine immunization for kids. So can that be given? Yes, it can, especially the primary series, which is when your child is less than 1 year. So all those vaccines are very important and should be given on time. So you can give it now. Make sure that you take an appointment at the hospital, go with your child, but do not take grandparents along. The booster series, which is what comes after the 2nd year and the 5th year, they can be delayed for a couple of days to weeks. That doesn't matter. But the primary series, please do get it done. Hydroxychloroquine can be used as a prophylaxis. So this drug is not the safest out there. It can cause a little problem with your heart rhythm abnormality, so you will have to take an ECG test before taking it. And also like rheumatoid arthritis and SLE patients are running short of it, so I would not recommend that you take this. Is there a vaccine for COVID or any cure? So vaccine, the trials are ongoing, but it will take a couple of months to a year for the vaccine to be released. Clinical trials are going on. As for drugs, there's no specific drug that they have found, but a combination of a few drugs are showing promising results, which they are using at present. What about pregnancy? Like if there is a lady with COVID-19, so there has not been any evidence that they suffer any increased mortality or morbidity, and after they give birth, they can breastfeed the child if they feel healthy enough to do it. They just have to wear a mask and wash their hands well before carrying the baby. So antibiotics do not help because it's a virus, so antibiotics will not really help in any way. So these were some of the medical questions. If you have any further questions, you can email or comment below. And to make a 5-minute video, it takes many hours of research and reading and watching webinars to condense all that information for you. So please do like the video if you found it useful. Thank you. Stay home and stay safe and take care.